Welcome back to Global Nurse Network, the podcast where we go beyond the basics to explore the tools, trends, and real-world stories shaping modern nursing. I'm your host, Rachel Cole, RN and healthcare advocate, and today we're diving into something that's not just changing the game, it's rewriting it. AI revolutionizes nursing. That's our hook today, but you're about to see just how deep this goes. Joining me in the studio are two incredible guests who've spent years on the front lines of healthcare technology. First up is Dr. Evelyn Park, Chief Nursing Informatics Officer at Mercy Health System. Evelyn, welcome. How's your day been so far in the world of data and AI?
Oh, Rachel, where do I start? I walked in here this morning to find out one of our AI models flagged a sepsis case 5 hours faster than our usual workflow. That's one less family facing a tragedy today. So yeah, my day's been humbling, to say the least.
Wow, that's not just a career highlight, that's a life. Next to her, we have Marcus Bennett, a critical care nurse turned clinical data analytics specialist. Marcus, you've worked in some of the busiest ICUs in the country. What's the first thing you think when you hear AI in nursing?
Honestly, relief. I've seen nurses burn out from alarm fatigue and running from room to room based on hunches. AI isn't just a tool. It's like having a second set of eyes that never blinks. Though I will say, when I first heard AI could predict patient deterioration, I thought it was another tech bros overselling something moment, until it saved a patient's life in my unit last month.
That's powerful. Okay, listeners, you're hearing it from the trenches. This isn't some futuristic fantasy. This is happening right now. Today, we're talking about 2026 nursing technology trends, how AI and data analytics are revolutionizing patient care. By the end of this episode, you'll walk away knowing exactly how to leverage these tools in your own practice, whether you're at the bedside, in administration, or still in school. And here's why this matters today. Healthcare systems are already racing to implement these technologies, and nurses who understand them won't just survive the transition, they'll lead it. Evelyn, let's start with you. When we talk about nursing informatics in 2026, what does that actually look like in a hospital?
Great question. Think of it like this. 10 years ago, a nursing informaticist was someone who could troubleshoot an EHR. Today, we're the bridge between clinicians and the algorithms powering their care. Take predictive analytics. Our system now integrates with wearables and monitors to run real-time risk scores. A patient's heart rate variability, oxygen saturation trends, even their lab trends over the last 48 hours, it all feeds into a dashboard that nurses see at the point of care. And the AI doesn't just alert us, it explains why a patient is high risk. Mrs. Johnson's risk is 78% due to her fluid balance dropping and rising CRP levels. That context? That's gold.
Marcus, you've worked in places where maybe pre-AI, the charge nurse was the de facto risk detector. How does AI change that dynamic?
It democratizes expertise. I've seen charge nurses with 30 years of experience miss subtle cues because, let's face it, we're human. But AI, it looks at thousands of data points across hundreds of patients every second. One hospital I consulted for implemented an AI sepsis alert system. We cut detection time by 60%. But here's the kicker. The nurses who embraced it didn't feel replaced. They felt empowered. One told me, it's like having Dr. Google on steroids, but one that actually knows what it's talking about.
That's such a key point. It's not about replacing nurses, it's about augmenting them. Evelyn, you mentioned dashboards. For a nurse who's never used one, what's the learning curve like?
Lower than you'd think, Rachel. Most modern EHRs now integrate these tools natively. The real challenge? Getting nurses to trust the data over their gut. We've had to train our teams to ask, what's the AI telling me, and why, rather than just dismissing an alert because the patient looks fine. Muscle memory is hard to break, but once they see the outcomes, like that sepsis case I mentioned, it clicks. Also, gamification helps. We run monthly AI trivia where nurses guess which patients will deteriorate based on the dashboard. The winners get their names on the leaderboard in the staff lounge. Peer recognition goes a long way.
Marcus, you're shaking your head. What's your take on the trust factor?
It's huge. I'll never forget a night shift where my AI alert went off for a patient. My brain said, "No way, they're stable." But the system insisted. I double-checked. Turns out, their lactate was creeping up, and their blood pressure was trending down. We preemptively called the rapid response team. Turns out, the patient was in compensated shock. If I'd ignored it, let's just say the "I told you so" from the AI would have been well-deserved. Now, do I blindly follow it? No, but I always investigate. That's the balance. AI is a safety net, not a crutch.
That balance is critical. And speaking of balance, let's talk about education. Many nurses are entering the field now who've never known a world without smartphones. How are nursing schools preparing students for this AI-driven future?
Slowly but surely, and that's the problem. We're seeing more simulation labs with AI patient avatars. Students practice responding to virtual patient deteriorations that adapt in real time based on their interventions. It's like flight simulator but for nursing. But here's the gap: most programs don't require data literacy. A survey last year found that 60% of new grads couldn't interpret a basic clinical dashboard. Evelyn Park, Chief Nursing Informatics Officer? I'm telling you, if nursing schools aren't teaching students how to query databases or understand predictive models, they're setting them up to fail.
Completely agree. I mentor new grads, and I'm stunned by how many think AI in healthcare is something that happens after they graduate. No, it's already here. One student I worked with thought machine learning was just a buzzword. We pulled up our hospital's sepsis prediction model, and she was shocked to learn that the algorithm behind it was trained on data from her clinical placements last semester. The light bulb moment? Priceless. But we need to make this part of the core curriculum, not an elective.
So the nursing curriculum is playing catch-up. That's a systemic issue, but it's solvable. Let's pivot to the tech itself. Evelyn, you've worked with countless AI vendors. What should nurses look for when evaluating these tools, especially with so many flashy startups popping up?
3 things: transparency, integration, and clinical validation. First, transparency. Does the vendor explain how the model makes its predictions? Black box AI is a non-starter in healthcare. Second, integration. Can it pull data from your EHR, wearables, and lab systems without requiring manual entry? If it needs a nurse to input 10 extra fields, it's not ready for prime time. Third, clinical validation. Has it been tested in peer-reviewed studies? We once considered a fall risk predictor that claimed 95% accuracy. Turned out, it was only tested on a population of 200 elderly patients in one rehab center. Not exactly generalizable.
Marcus, you've seen vendors pitch their wares at conferences. What's one red flag you tell nurses to watch out for?
We can implement this in 48 hours. Bull. Any tool that claims to revolutionize your workflow in a weekend is either a toy or a scam. Real AI systems require months of tuning to your patient population. Our hospital's AI sepsis model took 6 months to calibrate because we're a trauma center. Our patients are sicker than average. Also, watch for vendor lock-in. Some companies make it impossible to export your data if you want to switch systems. That's a major ethical red flag.
Oof. That's a critical reminder. Now, let's talk about the elephant in the room, job security. Some nurses worry AI will replace them. Evelyn, how do you address that fear?
By showing them the data. AI excels at pattern recognition, but it can't emote, advocate, or comfort a scared family member. In 2026, nurses who resist AI will find themselves replaced by nurses who use AI. It's not about doing less, it's about doing more, with better information. The nurses who thrive will be the ones who combine clinical wisdom with tech literacy. Think of it like the shift from paper charts to EHRs. Some nurses resisted that too, and look where we are now. We need to embrace this before it's forced on us.
And let's be real, nursing shortages aren't going away. AI won't replace nurses, but it will replace nurses who can't adapt. Ever tried explaining a patient's complex medical history to a resident in a 5-minute handoff? AI can summarize decades of data in seconds. But the nurse still has to use that summary to make decisions, communicate with families, and provide holistic care. The tech handles the noise, the nurse handles the art.
That's a perfect distillation. The tech takes care of the data deluge. The nurse takes care of the human element. Speaking of which, let's talk about burnout, one of the biggest crises in nursing today. How can AI actually reduce burnout instead of adding to it?
By automating the cognitive burden. The average ICU nurse spends 17% of their shift documenting. AI can handle a lot of that. Automated charting based on voice commands, smart alarms that filter out false positives, even predictive staffing tools that match nurse skill sets to patient acuity in real time. One hospital in our network used AI to reduce nurses' EHR time by 22%, and guess what? Their burnout scores dropped by 15%. That's not just a number, that's less time staring at a screen and more time at the bedside.
Marcus, you've worked night shifts where burnout is often worst. How do you see AI playing out there?
As a lifeline, night shifts are brutal. You're making split-second decisions with half the staff you need. AI can act like a second set of eyes for the charge nurse. We piloted an AI tool that analyzes patient vital signs and flags, at-risk, charts before the nurse even enters the room. On one shift, it caught a patient whose heart rate was trending downward for 3 hours, but never hit an alarm threshold. The nurse caught it in time, but without the AI, I shudder to think. Tools like this don't just reduce burnout, they save lives.
Let's dig deeper into the patient outcomes angle. Marcus, you mentioned earlier how AI reduced sepsis detection time by 60%. Can you walk us through a specific case where AI changed the trajectory for a patient?
Absolutely. Last year, we had a patient, a 68-year-old with COPD, admitted for a COPD exacerbation. Standard protocol would have had us monitoring his vitals every 4 hours. But our AI sepsis tool flagged him as high risk on hour 6 based on subtle changes in his heart rate variability and white blood cell count trends. We started antibiotics 12 hours earlier than usual. By day 3, his CRP levels were normal, and he was discharged without any ICU time. Without the AI, he likely would have deteriorated overnight, required intubation, and spent weeks in the ICU. Instead, he went home to his grandkids for the holidays. That's the kind of impact we're talking about.
Evelyn, as someone who oversees these systems at the health system level, do you have a big picture outcome that stands out?
One story really hits home. We deployed an AI readmission predictor across 3 hospitals, and it identified patients at highest risk of being readmitted within 30 days, based on everything from their lab results to their social determinants of health. The intervention? A nurse-led care coordination team that visited high-risk patients at home post-discharge with tailored plans. We cut 30-day readmissions by 28% in 6 months. But here's the part that stays with me. One patient, a homeless veteran, was flagged as high risk due to his unstable housing and lack of follow-up. The team connected him with a local shelter, VA benefits, and a primary care provider. He hasn't been readmitted in over a year. AI didn't fix his housing crisis, that took human compassion. But it did make sure someone saw him.
That's the ultimate example of tech supporting human care, not replacing it. Now, let's talk about the challenges. Privacy and security are always top of mind. How are hospitals protecting patient data in these AI systems?
With extreme prejudice, Rachel, we're seeing hospitals implement federated learning. Essentially, the AI model learns from data across multiple hospitals without that data leaving the originating site. It's like crowdsourcing intelligence while keeping patient records under lock and key. HIPAA isn't just a suggestion in these systems, it's baked into the architecture. The vendors we work with undergo rigorous third-party audits for data security, and we require them to sign data sovereignty clauses ensuring patient data never leaves our jurisdiction.
I'll add that the biggest breaches we've seen aren't from hacking, it's from misconfiguration. A nurse accidentally pastes a patient's data into a vendor's demo environment, or a temp agency logs into the AI dashboard with credentials on a sticky note. Training is just as critical as tech. We run quarterly data hygiene workshops where we simulate common mistakes and show nurses the real-world consequences. Fear of consequences, like a HIPAA fine or losing their job, is a powerful motivator.
That's a great reminder that the tech is only as strong as the humans using it. Speaking of humans, let's talk about the role of nurses in developing these AI tools. Evelyn, you've worked with data scientists. What's one thing nurses must do to advocate for themselves in this space?
Speak up. Too often, nurses are brought into AI projects after the model is built, usually to test it and give feedback. But we need to be at the table from day one, defining what good looks like for nursing workflows. At Mercy, we created a Nurse AI Council where bedside nurses, informaticists, and data scientists collaborate on every new tool. It's not just about avoiding workflow disasters, it's about ensuring the AI aligns with nursing values like patient dignity and evidence-based practice.
I'll take it further. Nurses need to own this space. There's a massive gap in nursing informatics certification. Only about 2% of nurses are certified in it. If we want to lead the AI revolution, we need to get certified, get involved in hackathons, and even build our own tools. One of my mints, a new grad, built a simple AI chatbot that helps patients understand their discharge instructions in plain language. It's not curing cancer, but it's filling a gap, and now she's presenting it at a national conference.
That's the rallying cry, own the future. Nurses aren't just recipients of AI, they're the ones shaping it. Before we wrap up the main content, let's address the 800-pound gorilla in the room, cost. These systems aren't cheap. How do smaller hospitals or clinics justify the investment, and what's the ROI for nurses?
It's about framing it in terms that hospital CFOs understand, and that nursing directors can advocate for. For CFOs, the ROI is clear: reduced readmissions, shorter lengths of stay, fewer adverse events. One critical access hospital in rural Iowa implemented an AI sepsis tool and saved $1.2 million in the first year, mostly from avoiding ICU transfers. For nurses, the ROI is less burnout, more time at the bedside, and the ability to practice at the top of their license. But it's also about future-proofing. Hospitals that don't invest in AI will struggle to recruit and retain nurses who want to work with cutting-edge tools.
And let's not forget grants and partnerships. Federally qualified health centers and rural hospitals can tap into HRSA funding for health IT innovation. We partnered with a small community hospital to apply for a grant, and they got $250,000 to implement AI-powered chronic disease management. The key was showing how it would reduce ER visits, a metric that resonates with funders. Grants are out there for the taking if you know where to look.
That's actionable advice. Thank you both. Now, as we wrap up the core content, I want to circle back to something Evelyn mentioned earlier about the angst nurses feel toward AI. Marcus, what's one piece of advice you'd give to a nurse who's overwhelmed by all this change?
Start small. Don't try to master AI in a week. Master one tool that solves one problem for you. Maybe it's an AI dictation app that cuts your charting time in half, or a predictive fall risk tool that gives you one less thing to worry about on nights. The goal isn't to become an AI expert. It's to use AI to make your job easier so you can focus on what matters, the patients. Small wins build confidence, and confidence makes you ready for the next step.
Evelyn, same question to you, but specifically for nurse leaders who need to champion this in their organizations.
Lead with the outcomes that matter to nurses: time saved, patients saved, burnout reduced. Too often, leadership pitches these tools as cost-saving measures to the C-suite, but forgets to translate that into time-saving measures for the nurses. When you frame AI as a way to reclaim their humanity, to spend less time clicking and more time caring, you get buy-in. Also, pilot small. At Mercy, we started with a single unit in one hospital. The nurses who piloted it became evangelists for the rest of the system. Never underestimate the power of peer-to-peer persuasion.
Perfect. And that's the pod angle I mentioned earlier. The power of peer influence can't be overstated in healthcare. This has been such a rich conversation, and I know listeners are going to walk away with a lot to think about. Before we close, though, I have to ask, what's one trend in nursing AI that you're personally most excited or terrified about for 2026?
I'm terrified of AI overload. We're already seeing early signs of alert fatigue with these tools. Imagine 50 AI-generated alerts pinging a nurse's tablet in an hour because the system is over-caffeinated. We need guardrails to prevent this from becoming another layer of noise in an already noisy environment.
And I'm excited about explainable AI in clinical trials. Right now, most AI models in healthcare are black boxes. We don't know why they flag a patient. But newer models are being designed to show their reasoning in plain language. Imagine a dashboard that doesn't just say Mrs. Johnson is high risk, but also Mrs. Johnson's risk is 78% due to fluid balance dropping 15% in 6 hours and rising CRP levels. That level of transparency could revolutionize both physician and patient trust in AI.
Both are such important perspectives, balancing innovation with human-centered design. This episode has been a masterclass in how AI and data analytics are reshaping nursing, and I hope it sparked some ideas for you, whether you're a bedside nurse, a student, or a leader. A huge thank you to Dr. Evelyn Park and Marcus Bennett for joining me today. Evelyn, Marcus, how can our listeners connect with you or follow your work?
They can find me on LinkedIn, just search Dr. Evelyn Park Nursing Informatics. I also have a monthly newsletter called The Data-Driven Nurse where I break down real-world AI case studies for nurses. Free to subscribe.
I'm most active on Twitter/X as at MARCUSINICU, shameless plug for all things nursing tech and critical care. I also co-host a podcast called Code Blue Tech with a few colleagues, where we dive into healthcare AI with a clinical lens. Check us out.
Fantastic resources. We'll include links to all of these in our show notes. Listeners, if this conversation resonated with you, hit that follow button and share this episode with a colleague who's curious about nursing tech. Next week, we're tackling another hot topic in healthcare, so make sure you're subscribed. And remember, read now. A heartfelt thank you to Dr. Evelyn Park and Marcus Bennett for sharing your time, expertise, and passion for this evolving landscape with us today.
Likewise, thank you to you and our listeners for creating space for these critical conversations.
Read now. If you found today's episode valuable, subscribe wherever you're listening and follow Global Nurse Network on social @NurseIn for more insights and updates. Before we go, visit nurse.giftstribe.com for additional resources and community connections built just for nurses. That's it for this episode. See you next time. Take care until then.
Thank you for watching. If you enjoyed this, hit subscribe and follow @NurseIn on social media for more from Global Nurse Network.